The government has revised its plan to tax sugary drinks, shifting from a volume-based system to one based on sugar content, following concerns from industry players. Closing the budget debate in Parliament, Finance Minister Fayval Williams announced that the special consumption tax on sweetened beverages will now be calculated using the amount of added sugar in each product. The tax was initially proposed as a flat rate per milliliter, but manufacturers argued it did not account for differences in sugar levels.
The special consumption tax on non-alcoholic sweetened beverage will therefore be levied at a rate of 22 cents per gram of added sugar rather than on the volume of the beverage. Madam Speaker, this change will require some lead time for manufacturers, importers, and our tax administration.
The Finance Minister says the move is aimed at tackling non-communicable diseases rather than generating revenue.
Madam Speaker, the logic of this design is simple and principled. It is the sugar that causes the harm, so it is the sugar that should be taxed. A beverage with no added sugar will attract no SCT. A beverage with modest added sugar will attract a modest SCT. A beverage with higher sugar content will attract a higher SCT directly and proportionally.
The implementation date has also been pushed back by 1 month, with the tax now set to take effect on May 1st, 2026, to give stakeholders time to adjust. Minister Williams is also urging manufacturers to reduce sugar in their products, noting that lower sugar levels will mean lower taxes.
Madam Speaker, I also want to signal clearly that this is not the end of the conversation, as we will monitor this application in practice, its effect on prices, on consumption patterns, on reformulation decisions, and on public health outcomes.
Sugary drinks in Jamaica are major drivers of non-communicable diseases, NCDs, with over 32% of adults consuming them daily, contributing to high rates of obesity, diabetes, and heart disease. Nearly 30% of children aged 5 to 19 are overweight.